Understanding specific learning disabilities and dyslexia services in Texas. This video will explain what specific learning disability means in Texas schools, how dyslexia fits into this category, early red flags, and what to expect when these learning differences overlap with autism or speech impairments. SLD stands for Specific Learning Disability, a federal IDEA category that includes challenges in reading, writing, or math. Dyslexia, dysgraphia, and dyscalculia fall under this umbrella. These learning differences affect how a student processes information, not their intelligence. Texas requires schools to follow the Texas Dyslexia Handbook, which outlines screening, evaluation, and evidence-based instruction. A student with dyslexia may receive services through special education under SLD or through Section 504, depending on their needs. In early elementary school, a child may exhibit difficulty learning letters, sounds, or rhymes, difficulty blending sounds, difficulty learning simple words, difficulty learning sight words, persistent reversals, B with D, P with Q, avoidance of reading or frustration, and difficulty remembering sequences. Children in upper elementary may exhibit the following symptoms: sluggish or incorrect reading, problems spelling common words, reluctance to read aloud, trouble summarizing texts, strong verbal abilities but poor writing, and excessively lengthy homework assignments. A lack of self-assurance when it comes to reading, a correlation between IQ and academic success, and a history of dyslexia in the family are all symptoms that can manifest at any age. It's perfectly normal for some kids to have more than one disability. Families may notice the following: SLD/dyslexia plus autism. The child might be able to read words correctly, but they might have trouble understanding what they mean, especially when it comes to figuring out what characters are feeling. It's harder to use reading strategies when you have trouble with flexible thinking. Sensory needs or anxiety may increase reading avoidance. The child may hyper-focus on details but miss the big picture of a story. Social communication differences can affect writing, especially narrative writing. SLD/dyslexia and speech impairment can make it hard to make some sounds and make it harder to develop phonological awareness. Having trouble hearing or changing sounds and words, a basic skill for reading. The child might know the answer but have trouble saying it in a clear way. Writing may be affected since spelling depends on precise sound recognition. Reading out loud can be stressful, which can make people want to avoid it. The school should evaluate all areas of suspected disability, not just one. The IEP should include integrated supports, not siloed services. Progress may look different across areas, and that's okay. With the right supports, children with multiple disabilities can thrive academically and emotionally. Students may receive structured literacy intervention, multisensory and explicit reading instruction, speech therapy to enhance phonemic awareness, and autism-informed supports such as visual schedules, predictable routines, and social communication scaffolds. Audiobooks, extra time, or less copying are some examples of accommodations. Parents have the right to ask for an evaluation at any time. Their kids received lessons that follow the Texas Dyslexia Handbook. Go to ARD or 504 meetings and get information in their preferred language. Dyslexia, SLD, autism, and speech impairments don't define your child, they simply explain how they learn. With the right support, every child can grow and succeed. For more information about the ARC of Harris County's Special Education Advocacy Services, The Right to Learn, contact 713-957-1600 extension 116.